And it's just been an awesome day. And Phil, I'm surprised you've gone this far into the day without having a mute button issue. I commend you for having trodden this marathon this far without any technical glitches. Wow, what a great day of sessions so far. Ani and the panel, just excellent information for everybody. So thank you for everybody that's contributed to this event. And we're going to talk about securing the healthcare data supply chain and third-party risk, which has just become one of the most prominent issues facing the industry over the last several years, but certainly this year and going into 2021. So I guess just before we do that, Jay, if you're going to be our Vanna White slide flipper person, if you could move to the next slide, we'll just introduce ourselves briefly, and I'll keep the bios short here so we can get into the content. But my name is Brian Selfridge. I'm a partner and one of the owners of MedITology Services. We're a firm that's dedicated to providing healthcare security, privacy, and compliance consulting services. So we'll tell you a little bit more about ourselves in a moment, but I'll allow Jay to introduce himself now as well.
Hey everybody, appreciate the opportunity to kind of share our thoughts. My name is Jay Stewart, Vice President here at CORL Technologies, and really looking forward to the discussion today.
Great, thank you so much, Jay. So in terms of agenda, we've got quite a bit on here, and we've got a relatively short amount of time. We'll be sure to sort of get through it all as expeditiously as possible. But we're going to start with a little bit of background on sort of how third-party risk has evolved over the last several years and kind of the state that we're in at the moment in sort of an elevated risk posture with respect to third parties and vendors. And then really the bulk of the conversation is going to be some insights from Jay here and CORL Technologies, who has conducted a study of their assessments of over 60, 70,000 vendors, healthcare security vendors, and seeing some of the security trends that we've seen across the organization or across the industry from those. So that's really going to be great to hear and great to see if you have some takeaways that you can bring to your own organization. And then, of course, it's the Q&A option. If we have some time to answer questions, we'd love to. If we don't get to them all, we'll, of course, follow up offline and afterwards as needed. So just a quick note on who Meetatology and CORL are, just for some context before we dive into the details. As I mentioned, Meetatology is a leading healthcare security and privacy firm. So we do some work with the federal government, OCR, HHS, and the US side. We have work predominantly in the US, but also have some clients overseas, and employ a number of ex-security officers, privacy officers like myself that have been in industry and are sort of back on the other side trying to help out from our capacity. And vendor risk is just one of the areas that we specialize in, which is what we'll talk about today, supply chain risk. But we also offer a number of other services like security risk assessments, pen testing, which Taylor was talking about a moment ago, certifications, high trust SOC 2s, medical devices, so the whole gamut of stuff. So that's enough about us, but I just want to let you know some context about where our perspective is coming from. And so, Jay, if you want to flip to the next, you can give a little background on CORL as well.
Sure, and just really quickly before we jump into kind of the study here, CORL is a tech-enabled managed service, so interesting kind of discussion in the previous panel for vendor security risk management and assessments. We've got about 65, 70,000. That number changes kind of daily with the folks that we bring on. Under our purview, we work with hundreds of clients coast to coast. And really look at kind of this equation of vendor security risk management and focus on the output or the outcome, which is overall vendor risk reduction. And we'll certainly share some insight into how we get to that outcome here in a second.
Great, thanks so much, Jay. So just a little bit of background on how this third-party risk supply chain situation has evolved over the last several years. So I remember, if I flash back 8 to 10 years ago and think about when we looked at third-party risk, the applications that we were concerned about and paying attention to were really the minority. It was new applications. Maybe we had some data analytics applications or IT-focused systems that were moving to the cloud and moving into third-party hosted environments. And that was the exception and not the norm. But I think it's pretty clear now in 2020 that it's the other way around. It's flipped on the side of its head, where the exception is to have an on-premise system and to not have a vendor involved, be it in a managed service capacity or just core systems being used downstairs in the data center has become sort of the rarity. So not only that, it's not just these ancillary one-off systems that we're moving to third-party hosted environments, but it's become our most critical systems. So your electronic health records, your financial systems, the lifeblood of the healthcare enterprise are now running and dependent on third-party vendors. And we've just reached a situation where the sheer volume of vendors that we need to pay attention to and the risks that they're holding for us, and we're dependent upon working with them to manage, has just become almost overwhelming for many healthcare organizations. And that's led to a lot of organizations having decreased visibility into their security risk posture overall by just not being able to keep up with the sheer volume of vendors. So if we can move to the next slide there, Jay. So we still see a lot of information security programs having certainly an element of third-party risk as part of the program. So when you see organizations doing enterprise-wide risk assessments, they'll look at all the various security control areas that you would expect to see, but the weighting and the prominence of the third-party risk is still sort of left off to this sort of the side, and it's like, oh yes, and we have third-party risk. Whereas I truly believe that over the next several years, we're going to have to really look at third-party risk as the primary function that we do in managing where our data and systems are secured, as they're just fewer and fewer going to be on-prem. So if you can flip to the next one, Jay, thanks. So, you know, the breaches that we're having with third parties, back again, years ago, we used to worry more about the confidentiality of data. And certainly we still care about that, right? Our data is going everywhere. It's proliferating across these applications and systems. And that's of a concern from a compliance standpoint. It's a concern from a patient privacy perspective, of course. But I think even more challenging is that now when we're having these breaches, they're more impacting the availability and integrity of our critical systems. So, you know, without going into the details, I'm sure everybody is paying attention to these ransomware attacks and the latest alerts where you're actually having patient deaths and you're having real impacts, financial impacts, and patient safety impacts related to security events. That's also applying to our third-party incidents as well. A couple of years ago, we had Nuance Transcription had a big ransomware outage, and they're a business associate and third party to a large majority of health systems, at least in the US. And that ransomware event took the availability of that critical function away, as well as the ransomware started hopping over VPNs onto clinical networks and things. So that impact statement is so much bigger now than it ever has been. When we're having these breaches to affect patient safety and operations in a way that they never have before. So the last thing I'll leave you with, and Jay's going to really get into the nitty-gritty and the meat of what we're seeing with the posture of these third-party vendors. So I mentioned we're sort of less focused on compliance these days, but it's still something we have to pay attention to. We did a joint presentation with OCR earlier this summer where that was focused on third-party vendor risk. And we highlighted some of the breaches that have been occurring over the last year or so. And I won't go through each one, but these are some of the fines and some of the resolution agreements that are directly related to lapses in third-party risk business associate compliance. So we not only have these availability issues, patient safety, all these things, but we also still have to keep an eye on the enforcement activities because the OCR and other regulators are really tuned into this challenge and this issue and driving enforcement around it to help us sort of get our act together as best we can. So a lot more we could say about this, and given the relatively short amount of time, I want to make sure Jay has enough time to share with you his insights. So I'll turn it over to you, Jay, to give us a sense of where are these vendors actually standing with their capabilities.
Yeah, thanks, Brian. Really appreciate it. So what we've kind of put together here is kind of a three-step approach in kind of series of data sets that highlight kind of the who, what, when, and where when it comes to healthcare vendors. And so we'll look at some demographic data. We'll look at some trends that we're seeing in the space. And then we'll leave the audience here with some kind of guidance or some tips and tricks for vendor risk management, third-party risk management. And so jumping into kind of the data set, as we've mentioned, about 70,000 vendors that we have analyzed since our inception here at CORL. Kind of the results that are being derived out of this are essentially desktop audits, right? And then we'll look at kind of the practices of about 120 companies and kind of give you some insights into what's working, what's not working, and then how we can progress as an organization, as an industry, to better ourselves and better our third parties. So let's jump into some of the demographic data. So we wanted to kind of start with giving you some insight where we're seeing vendors have access to the most healthcare data, right? So PHI, PCI, PII type data, heavy regulated information. And you'll see here kind of that's taking the cake is business services. And to give you some insight into what those vendors are, these are commodity type vendors, right? Travel, shredding, printing, marketing, financial, business intelligence, right? You then see clinical. So this would be like your clinical pharmacy companies, right? Imaging, Chris mentioned DICOM, right? So those imaging vendors, surgical video platforms. Your other, these would be your associations, your conglomerates, like your GEs of the world. So this just gives you a sense of the vendor types or the vendor kind of sectors that have access to PHI. And this gives you some insight into where you should be paying attention to your overall vendor population, right? The folks that are on the line likely have hundreds, if not thousands of vendors that they're dealing with. And when you look at that at kind of a 30,000 foot view, how are you going to deal with these thousands of vendors within your portfolio? The only way to do it is to start dissecting them and understanding the traits and the characteristics that these vendors have, and then using that data to help sort through and drive efficient assessment strategies and mitigation strategies. And so one thing that we always look at is kind of the size of the vendor, right? So how big is the vendor that we're dealing with? And we measure vendors based on employee size, or employee count. So you'll see here a very interesting point that we see that is probably outside of healthcare, but focusing specifically in healthcare, is that about 90% of vendors that our clients are dealing with are very small and small companies. And so those are organizations with 500 employees or less. And you think about sending over, a questionnaire or asking for a high trust certification or a SOC 2, these smaller companies likely do not have the expertise on hand to go get those certifications, or they don't have the guidance to go get that assurance in the market. And so being able to think through, how do I manage these hundreds or thousands of vendors? You got to start thinking through, how am I going to work with these smaller vendors? And then more importantly, what are some non-negotiables regardless of size, right? And we kind of call these key controls. What are those key controls that, even if it's a 5-employee shop and they're out of someone's garage, that you're going to hold their feet to the fire and really make sure that they have those key controls in place to ensure that your PHI and your patient's PHI is properly protected and maintained. And then we'll jump into kind of the overall security exposure that we're seeing. And so one thing that we do here at CORL is kind of bucket vendors into what we call vendor types, or you can think of this as sectors, right? And so what I'll walk you through in these next couple of slides is the top 10 vendor types by likelihood, by impact, and then once we calculate risk, what are the highest risk vendors that we are seeing in the healthcare space to date? So first off, from a likelihood perspective, these vendor types time and time again are failing CORL's detailed security assessments and reviews. Surprise, surprise, medical devices is popping up to the top, right? Some other ones would be your financial services, your revenue cycle, the AMCA breach, if anyone has heard of that. I think last time I checked, it was 24.4 million patients, patient records had been affected. financial services black bob, if anyone's dealing with that right now. And then one area that I don't think a lot of organizations think about are legal services. And so these are the top 10 vendor types by likelihood. If you look at the other side of the equation, right, by impact, who are the vendors that have the most access to sensitive data? Medical device still taking the cake here. And then you can see some others here, right? Clinical pharmacy, retail pharmacy, a big one as of, this year, and what COVID has, really kind of really springboarded would be telehealth, right, and home health. And so making sure that you're thinking through these vendor types and saying, hey, these are my highest impact vendors, right? And then when you bring that all together, who are the highest risk vendors that healthcare is seeing right now, that CORL is seeing? These would be medical devices, healthcare consulting organizations, and clinical pharmacy. And so if you get anything out of this presentation that Brian and I do today, it would be, let's pay attention to these three vendor types, because the odds are they are presenting a high risk to your organization, and they're worth looking at in more detail from an assessment perspective. And so next I wanted to kind of look at and compare how healthcare looks and feels, and really kind of compares to the industry as a whole. And so some things that we wanted to just kind of point out to the audience today is security certifications. And I know it's a big thing. We've got folks that say, hey, you got to go get a high trust certification, right? That's great. We love assurance, right? You got to go get a SOC 2. That's awesome. We love assurance. But when you look at the market and you look at healthcare in particular, only 22% of your vendor population are going to have a certification. And so what are you going to do with that other large percentage of your vendor population that doesn't have a certification, right? What are some of your assessment strategies to address that large gap in the market? Is the fact that these organizations just do not have security certifications. On top of that, we look at what vendors actually have security personnel on staff, dedicated security personnel. So this isn't, individuals wearing multiple hats, right? These are dedicated security professionals at the vendor level. And what's interesting is only 37% of the vendors that we have looked at have dedicated security staff. And if you think sending over a NIST 853 or 171 questionnaire that's 300 questions, or a SIG core that's 800 to 1600 questions, if you think that's going to get filled out appropriately and filled out on time, you need to think again, right? Because the odds that questionnaire goes into the black hole or into the abyss and is never seen again are very, very high. And so something to think about as you kind of look at and strategize on how you should be assessing your vendors. Maybe it's just a quick phone call as an example. We then wanted to share with you some trends that we're seeing in kind of our assessments and where vendors are failing from a security control perspective. And so you can see some of the more prevalent issues that we're seeing, and that would be access control, authentication, authorization, system data protection are just some of the top three that we're seeing when vendors do fail our security assessment. And then finally, we wanted to kind of end this with, okay, we've got a lot of data, right? But how does that data translate into building and maturing and scaling? And scaling is a big thing, especially in healthcare, your vendor risk management program. And so I think probably the crux, or kind of the biggest foundation advice I could give to the audience today is leveraging inherent risk and other data sources to tier your vendor population. As I mentioned earlier, you likely have hundreds, if not thousands, of vendors that you have to deal with. And you're not going to be able to perform a desktop audit on every single vendor, right? It'll blow your budget and you'll be out this for 15 years and never get to the bottom of it. And so using the inherent risk and using other data sources like cyber ratings to tier out your vendor population is a very efficient way to help drive your assessment strategy. And so I'll share with you just some examples in kind of the tier 1 and versus tier 3, right? So a tier 1 vendor, this would be your EMR, your EHR vendor, right? Having access to pretty much all your PHI. And so therefore, you're going to want to put them through a pretty extensive assessment, right? You're also going to want to validate their responses. So looking at evidence like a pen test. I know we were talking about that in kind of the previous panel. You're also going to want to have remediation oversight on that particular vendor. You might want to exercise a continuous monitoring license from a cyber risk vendor, right? In regards to kind of a tier 3 vendor, maybe it's a scaled down version of that assessment with limited validation, right? The risk that this vendor presents, this inherent risk that this vendor presents, just doesn't warrant the detailed review that a tier 1 vendor warrants, right? And then the other thing that the tiering does for us is it drives the reassessment process. So how often should you come back and look at that vendor? Is it every year? Is it every other year? Is it one and done, as an example? And so that's something that I would recommend organizations look at first. We also wanted to share with you some client preferences that we're seeing, kind of preferred questionnaire frameworks. Obviously NIST and HITRUST, there's if you like NIST, you probably don't like HITRUST, and if you like HITRUST, you probably don't like NIST. There's not a lot of folks that like both, and that's, I think, a larger issue here for the industry is we don't have a preferred framework, which is a bit frustrating. And then also, obviously HIPAA. Some preferred certifications: SOC 2 Type 2, HITRUST, and ISO. Those are the prevalent certifications that we're seeing in this space. And then some kind of technologies from a GRC perspective, you can kind of see those here. In regards to questionnaires, I would recommend organizations have a preferred framework, but don't be stuck to a one-size-fits-all questionnaire. You need to leverage different types of questionnaires, maybe a smaller questionnaire for your smaller organizations, or depending on scope. And I know, everyone's moving to the cloud, and that means your third parties are moving to the cloud. And so using cloud-based questionnaires that focus around AWS or Azure are great ways to get to the bottom of what is the risk that this cloud application or cloud vendor presents to the organization. We also wanted to just kind of share with you some kind of stats that we're seeing in regards to vendor responsiveness. This is a big thing, right? When you mature your program or even implement vendor risk management, you're going to have business owners that say, hey, this is slowing down my speed, my time to market. And from a clinical perspective, that can be a big impact on patient care. And so you need to have a fine balance between security and speed. And sometimes speed has to win. And that's okay. But making sure that you can have a right to audit in that contract is also equally important. And so in some cases, let speed win. And there's ways to do that in regards to the assessment. And you can see here some of the stats, kind of the questionnaire turnaround time, the assessment turnaround time, as well as remediation, and kind of what thresholds our clients are putting on kind of critical risks to be addressed, say within 30 days, or high risk to be addressed within 90 days, as an example. Finally, we wanted to just give you some insight into, if you have all the basics, kind of the blocking and tackling in place, what's that next phase for your program, right? How do you take it to the next step? And for us, that is really bringing into the equation KPIs and KRIs. And you can see here on the screen some of those KPIs that we use with our clients, and being able to report on these and share these up to a steering committee or even at the board level helps really bring in third-party risk management to that next level. And as Brian mentioned at the very beginning, you're only going to use more and more third parties. And so this is going to be a more and more important topic to report on and to shed light on to board members, to VPs and steering committees, and all the way down to the operational level, and making sure that your KPIs and KRIs can go up to that board level, but they can also come down to the operational and tactical level, are very important. And so I know we're right at time. And so in closing, we've talked a lot about how third parties present, major risks to the healthcare industry and your specific organizations, and the importance of understanding those relationships. But as we depart from our discussion today, we'd like to reiterate the importance of keeping scale in mind when maturing your program, because again, you have hundreds and thousands of vendors that you're dealing with, and going to the nth degree for every assessment just doesn't scale. But you've got to be able to use data and insights and trends to pinpoint who you focus on, what you focus on, and then how you move those levers and how you reduce that risk over time. And so we'd like to thank everyone who's on the line today for your time and attention. I would say, due to some of the condensed time frame, we probably don't have time to get to questions, but we certainly saw some kind of come up in the chat. And so we will address those. Just fire out an email or from Richard, or we can address those now, but happy to kind of be flexible in that approach as well. So thank you.
Great. Thank you very much, Jay. Thank you, Brian.
I think we have time.
Yeah, I think we can probably squeeze one or two questions in.
Perfect. So in the chat box, Helen asks a high-level question about getting people to take those surveys seriously, as if it was their own physical security. Obviously, that's an age-old debate. Your company's info versus getting kidnapped. I don't know if we can take it that far, but what do you think?
To address the actual question, the questionnaire, the assessments that are to take those more seriously, or to address those in a timely manner, what we have found is really kind of putting the vendor in our client's shoes, right? So saying, hey, if we get breached, or if you, vendor, get breached, we're on the front page of the news, right? And so putting that real world kind of impact in front of the vendor to say, hey, look, we're not doing this just to put you through a 300 question questionnaire. We're doing this to make sure that when we sign up with you, or when we renew with you, that we are confident that we're not going to be on the front page of the news. And if you look at GDPR, we want to make sure that those financial impacts, really don't hit our bottom line. And so I would say putting those consequences in front of the vendor to say, hey, here's what we're dealing with. We're in a highly regulated space. The least you could do is give us assurance that you can actually protect this sensitive data.
Yeah, and get it in the contract, to the extent you can, to provide that leverage to be able to actually not only an upfront assessment, but ongoing compliance with the requirements and risks as they evolve over time.
I like it. There's a comment, and Ahi says she's surprised that encryption is not on the list of failing controls. I think you had a slide up, but I don't know what you think of that.
Yeah, I think Jay, I don't know if you know that. I think encryption's embedded in one of those categories.
Yeah, I'd have to go back and look at it, but
it's in there. It's we'll get back to Yanni on which one it is, but we haven't figured out encryption yet. You're correct.
Okay, perfect. And then Kenji says, what about using tools like Risk Recon? They do public scans and rate each third-party vendor's security within their own industry. I don't know the tool, but I don't know if you know it.
Yeah, I would say from we like risk ratings, but they just give you that kind of external feel, right? They're not giving you the under the hood, the detailed information that a lot of healthcare organizations need as they implement these applications and these products into their network. Cyber ratings certainly have their place. They can help you scale your program, but for those critical and high risk vendors, you're still going to have to kind of look under the hood. So that would be my recommendation.
Yeah, and they don't know, they're great because they are an important part of the process, as Jay mentioned, in terms of tiering your vendors. The cyber risk scores are a great way to sort of get a quick sense of which vendors have sort of an external posture that looks good, bad, or indifferent. But when you look at assessing your vendors and your products, you've got to get down to the specific products and applications that are in use. You've got to get down to the business context of how they're being used in your business, and being able to provide that level of insight and advisory back to the business to say this is something that poses a risk or doesn't. Often that external score that just says, hey, GE is really good at security or not, doesn't tell the story when you get down to the, the hundreds of different applications and systems in their portfolio, and how you actually plan to use it in your environment.
Brilliant. No, I like it. Well, over to Richard, and I think we're now out of time.
I think we probably are. Thank you very much, Jay. Thank you, Brian. Great to see you again.
Thanks, Richard. Always a pleasure.
Yeah, likewise. And thanks for sharing your insights and experience and expertise with all of us here this afternoon. So
thanks, everybody.
Great.
And thanks to Meetatology and CORL for supporting this event as well.
Indeed. Thank you, gentlemen. Thank you, companies. So we are now in the light of one of the questions which talked about the linkage between cybersecurity